My name is Dr. Casey Daniel, and I currently work at the U.S.A. Mitchell Cancer Institute. I was diagnosed with cancer when I was 16 years old, but it was very evident that I was abnormal. I was not the usual case, and that was kind of a theme throughout my cancer journey. I've spent the majority of my life in hospitals and physician clinics, in and out of treatment, and having migraines, having aches and pains, and cognitive issues and memory issues, and it kind of makes you feel a little bit robbed. And I don't say that in a pity-garnering way by any means. I just mean that it's tough sometimes to feel like, I wonder what it would be like to have led a perfectly, quote-unquote, normal life. Cancer does not end when your treatment ends. That was a completely new concept to me and to my family. We were all celebrating the day I finished treatment, which was a huge milestone and celebration, but it wasn't the end. And we were not prepared for that next part of the journey. So I have a mass in my liver. So when I was about 30-ish and my husband and I were starting to talk about maybe starting a family, I found out that that was something I had to consider and that maybe it wasn't safe for me to get pregnant. That was a huge shock. And I don't know if that's a late effect, but it's something that I never considered. It kind of makes you feel like cancer haunts you. Having gone through all of that, I feel like has made me who I am in a great way. I have now been able to dedicate my life to researching cancer, to helping other people to never feel the way that I felt. Part of my mission became to make sure that no one else ever had to feel that way, of this shock of, I've already been through so much and now you're throwing this at me too? I mean, wasn't the other stuff enough? Cancer is not something that you are necessarily just cured of after your treatment's over. It is something that you deal with your entire life. It's a chronic disease. I have a teddy bear that I got when I was going through chemo, and I still have it. It's in my son's room now, and I'll never give it away. I'll keep it forever.
Cancer is just something that we all have to recognize, acknowledge, cope with, live with, struggle with, rage upon, crush, and even thrive with. This show is more than knowing and fighting or beating cancer. It's more than just relaying science, hope, and technology. Together, our purpose is to demystify cancer, take away as much fear out of the diagnosis, treatment, and process as we can, defeat its grip on our lives. This is The Cancering Show. Dr. Daniel, Casey, thanks so much for coming into the studio today.
Thank you so much for having me. It is absolutely my pleasure.
Well, I'm particularly excited just because we get to see each other every day as part of our work on cancer prevention, but we're really good friends. And it's fun to have this opportunity to get your perspective on the Cancering podcast and your work.
Yes, I completely agree. And it's nice to be able to talk about this in a setting where we can share our work and also our perspectives with other people who may not have a chance to hear kind of what we go through and also what we do on a regular basis.
So, Casey, you are a cancer doctor who's not a physician. Explain that to our listeners.
That is a question I get asked a lot. So I have a background in public health and in behavioral epidemiology and health behavior. I got my PhD and did my master's in public health and did a postdoctoral training fellowship in cancer control and prevention. So my focus has always been really looking at cancer and how we can prevent it, because I think Benjamin Franklin said, an ounce of prevention is worth a pound of cure. And that is kind of how I've lived my whole life in that mantra.
On the podcast, we had the opportunity to hear your story, which is just so incredibly powerful. And we've talked a little bit about the experiences that you went through, surgery and chemotherapy. Is that what drew you into this research field?
I knew that I always wanted to be in healthcare, in medicine in some way. And I tell my students now, I have a lot of medical students and even undergraduate honors students and other graduate students, that if you had asked me 15 years ago if I was going to be a researcher, I would have shut you down really hard because I never would have thought I'd be in research. I thought I didn't like research. I didn't like lab research.
Right. Me neither. But God love the people who do it. We are so glad to have folks at MCI doing that every day because we need those folks too. But what you do is such a vital part of MCI as well. Thinking in my mind about your story, you were a patient, you survived this cancer, and really turn it into not just a positive outcome for yourself, but into your life's work. It just gives me chills.
I just think that everything happens for a reason, and you're put in certain situations for reasons, and you don't know what they are. And you can look at certain experiences as, why me? And this is ruining me. But you could also look at them as an opportunity. And I have always wanted whatever I did, even if I was, working as a cashier somewhere, or if I was driving a bus, although they'd never let me drive a bus. I'm not a very good driver. I'm just going to put that out there. Whatever I was doing, I wanted to do it well, and I wanted to make an impact on people. And this gave me a background and a personal point of reference to help people. And so I really focus now with working to help childhood cancer survivors because that was my basic point of reference. So I did a postdoctoral fellowship at Harvard, and we did a study with all these childhood cancer survivors who had radiation. And if you've had radiation treatment for cancer, especially when you're young, then you're more likely to have skin cancer later. Well, what could be more of a marriage of my interests than childhood cancer survivors and skin cancer? So I worked with a very brilliant mentor at Harvard on this intervention to reach out to these survivors and say, did you know that you're at risk for these cancers? Because a lot of them don't. And to say, did you know that you should be doing this and this and this because you're at higher risk? And, helping them to detect it early, helping them to take extra measures so that they don't increase their risk even further. The same for colorectal cancer. If you've had certain radiation to your abdomen or spine or pelvis when you're a child, then you're at greater risk for colorectal cancer. So letting them know, you have to get the colonoscopies and the other type of colorectal cancer screenings earlier in life than the average citizen or average individual is recommended to. So those were some of the things I did early on. And then when I got to MCI, I decided I wanted to expand that even further and not just focus on the survivors and what they had experienced, but focus on all individuals. And that's what led me into the HPV research, the human papillomavirus research that we share.
Yeah, I was going to say, this is really where our interests crossed. So, we have talked about cancer in your life before you were a doctor, of course, Dr. Casey Daniel, the cancer researcher, but you now have a different role. You are in a support role now. Tell us, our listeners, about that.
So I come from a very, what I call a dysfunctionally close family. I have two sisters, and we are fiercely protective of each other. I'm the middle sister, so clearly the best of the sisters.
Of course.
So earlier this year, my younger sister called me. It was a Wednesday, and she said her 11-month-old son had a mass in his stomach that she had felt, and they went to the pediatrician, and the pediatrician said that she wasn't even going to run scans. She was sending them straight to their local children's hospital, to the oncology ward. And she was terrified, as anyone would be. And it's relatively far from where we are. I couldn't get there right away, but our mom was on her way. And they did scans the next day, and they found that there was a tumor growing out of his kidney. It was a Wilms tumor, which is a pediatric cancer.
That's kind of a rare tumor, isn't it?
It is, and pediatric cancers in themselves are rare, and then among them, this is a rare solid tumor. And so you immediately, your mind starts to turn and what's going to happen. And the oncology team said it has to come out. And so she called me on that Wednesday. On Friday, he had what turned into a 9-hour surgery removing the large tumor and his kidney. And my sister was told that he would have about a week's worth of radiation treatments and about 6 months of chemo treatments.
I can't imagine how hard that was for you, knowing what you know. How did you handle that?
I got on a plane, and I was there by Sunday before the treatment started. And my sister had asked, and her husband had asked me to come. I met with their oncology team, the radiation oncologists, and I have some colleagues who are at that institution who I met with as well. And I basically served as support and translator.
Yeah.
Which was a big part of it.
Right. I always say, I was helping a family and the nurse said, oh, they don't speak good English. And I said, no, you don't speak good English. These people need to hear this in English, and you are using too many medical terms.
And that's 100% true. Before I got up there, when the physicians and nurses would be talking with my sister, at first she was trying to just listen and take notes and then text it to me or call and tell me about it, but she couldn't, the spellings were crazy, and I would say, do you mean this or do you mean that? And so finally she got to where when they came in, she just put me on speakerphone. And then she was telling her physician, which I don't know how that really went with building good rapport with the physicians, but that I had looked up their papers. And not because I was checking up on them, I was just interested in what their research interests were and whatnot. So we built some possible rapport that way, but it put me in a really unique position because I've had family members we all have had family members who've had cancer. I had an uncle who passed away of stage 4 pancreatic last year, and it was really tough. And everyone wants to kind of ask you questions about it. And we've all had other friends and family who've had cancer. But this is my nephew. It's my little sister.
This hurts.
It's right. I mean, I still think of my little sister as a baby. She's mine. I protect her. I want to keep her from all harm, much less her not even 1-year-old son, and who is just behind my son in age. And now all of a sudden I'm the sister, I'm an aunt, I'm a daughter, I'm cancer survivor, I'm cancer researcher, I'm all of these things, and having to balance that is, I don't even know if it's possible.
Yeah. You in particular mentioned your feelings and relationship with your mom, knowing that she's been through this once before.
I told my sister that, a lot of people are going to tell you, oh, I know how you must be feeling, and they don't. But that my mom actually does, because she's had to go through this with her child. And then it struck me how horrible that is, and that my parents were reliving a nightmare because they had already had to do this with one of their own children, and now they're having to do it with a grandchild. And then that inflicts all kinds of irrational, I understand it's an irrational feeling, but guilt that I have because I, through no fault of my own, put my parents through a horrible, painful experience 10, 15 years ago when I had cancer.
Let's put that blame where it belongs. Cancer put your parents through that, not you.
That's true. But then your mind starts, you can't help but wonder and let your mind wander and, late at night go, I've already screwed things up in terms of the peace and stability on the healthcare front for my family. Should it have been my son instead of my sister's son?
It just breaks my heart to hear you say that.
And of course, I would never wish anything. I wouldn't even want a knee boo-boo for my son. But, I don't want that to be a burden my sister has to bear too. I already know that guilt. I've lived that guilt, and I've been in therapy for that guilt for years. I don't want her to have to deal with it too. If I could take that burden from her, I probably would.
Well, I think what you are expressing is something that a lot of family members feel as support. And sometimes, we're talking about real genetic connections between cancer. One sister diagnosed with breast cancer, another sister diagnosed with ovarian cancer, or a mom and a daughter. And some of these emotions surrounding cancer and cancering are really painful, negative emotions. Guilt is definitely one of them. A lot of anger for some people. For, in particular, we talk about cervical cancer and shame. And the really learning, like you said, with counseling and things like that, learning how to confront those negative emotions head on and recognize that it's not you. You are not to blame. Everybody has some burden to bear, some reason that it happened, that we don't know right now what that reason is, but that, not unlike your story, it really can be part of a beautiful fabric that leads to good.
The irony of it, a very twisted irony, disclaimer, is that I have felt like I've spent the past 10 or so years, ever since I leapt into that professional type part of my life, trying to fight cancer, trying to help others, trying to make an impact positively in this world against cancer. And then I go, have I become this talisman of cancer that is just drawing it? I had cancer, and then I've had my own scares with recurrence and swollen lymph nodes, and had to have biopsies here and there of certain things. And then my entire life is cancer. Did I somehow bring this on to my family by living my whole life revolving around cancer?
A lot of people experience that question of blame, whether it is for you kind of that feeling that like you're drawing it in. For other folks, it could be much more tangible, cancer related to weight or to smoking. And again, that blame and that guilt need to be put in its place to say nobody brings cancer on themselves. And that for a lot of people, part of cancering is some type of counseling or sometimes of just discussion. For some people, that's support groups or health coaching or a therapist to really go through and address each one of these, to name them and to say, I'm feeling guilt, I'm feeling shame, I'm feeling blame, I'm feeling angry, and to really get to the heart of it and to move on. The other one you mentioned is fear. There's a lot of fear associated with cancering, with being a survivor of cancer. When you look at the emotional toll of a cancer diagnosis, most people equate it to post-traumatic stress disorder, that it is not dissimilar to someone walking up to you and holding a gun to your head. And you have to work your way through that fear. It strips away every security that you had, that you could predict what tomorrow would bring, because all of a sudden you don't know what tomorrow is. And those of us who haven't had a cancer diagnosis are living in our own little happy world thinking we know what tomorrow will bring, when in actual fact, none of us are guaranteed a day.
Well, and in some respects, I think that's why in an alternate universe, wish I could take this burden away from my sister, because I feel like I am better equipped to handle this because of what I've been through, because of what I know. And it's really, really hard to balance out my knowledge and with my profession and balance that out with my role as a supportive caregiver and supportive family member. It's hard not to think in terms of statistics because I see those every day. I read them every day. I think in terms of rates and incidents and mortality and things like that. And this made it really real again. You're the same way with what you see every day as a practicing physician, to see not just a real person, but to see my own baby nephew.
Right.
And then
one of my attendings used to say that mortality is not 70% or 30% for that patient. It's either 100% or 0%.
I think that's very profound. And what information do I tell my sister and when do I tell her? It's a burden of knowing information, knowing facts, knowing possible things. And it goes back to what I said about what really led me into this field of research is I didn't want anyone else to feel blindsided like I did when I had all of those cognitive late effects and couldn't remember things and no one had ever told me that stuff. I didn't know those were possibilities. And I don't want her to wake up in 5 years or 10 years or 15 years and her son to be experiencing things and her look at me and say, why didn't you ever tell me that this was a possibility? But I also don't want to tell her every possible thing that could happen and scare her unnecessarily.
As physicians, we deal with that a lot in terms of managing expectations, but also not scaring patients about things that really have a low chance of affecting them. I wanted to get back to something you said about kind of you felt kind of better prepared, and yet you had mentioned that, when you were going through it yourself, people said to you, how could you do this? I couldn't do it. And you were like, well, it's not like I had a choice. It came up in one of our patient stories as well. People bear it because they have to, not because they are particularly well equipped to bear it.
I think you may not think that you're born a superhero, but you become a superhero, or you become that amazing, super mighty Wonder Woman.
Your sister has become.
She struggles with so many things, and she's not, geographically, we really just tried to give our parents just horrible twist that knife by us dispersing geographically so that they couldn't have us all in one place at one time, unfortunately, which I really hate because we are so close. So she has really great friends where she lives, but she doesn't have that immediate support system of family right there. And we call and text and FaceTime every day. And she tells me, I'm exhausted. I'm a type of exhausted I didn't know you could be. And that she misses things that that she took for granted that she didn't even think you could miss. She wishes that she and her husband and son could go to a restaurant and just eat in a restaurant. But, with her son being immunocompromised from all of the treatment, and, he's had to have blood transfusions. He has every week is a struggle with his weight checks and his platelet checks and his counts. And, so they can't go out and go to the store. They can't go to a restaurant. These little bitty things. And I wish I could just take some of it from her. And now with the scare of the measles, he can't get vaccines. And she said, when she took him home from the hospital, she said, after all of the initial surgery and everything, she said, I have him home. He's in the next room. He's in his crib. And I feel like I can't protect him. And it is the scariest feeling I've ever had. And those are times when I go, okay, this is not researcher mode. This is sister mode. And I want to be positive, but I want to be realistic. And I know that when they were in the hospital and I was up there visiting that first week of treatment, my father and I were in the elevator, and it was the day before he started all of his chemo treatments. And I just was kind of taking it all in, and everyone was kind of celebrating this victory of, the surgery's over and it went well and this is so great. And I was happy about that. But I also didn't feel, I knew from my own experience after my surgery, I felt, woohoo, we're done. This is great. And that was not at all. That was just the beginning. And so I kind of said, just between me and my dad, I said, tomorrow everything changes. Once he starts chemo, everything changes. And it completely took my father aback. He was shocked and felt that I was just that I had sucked all the air out of the room or something. And because they were celebrating, and it was, but this is a great way. Yeah, everything changes in a good way. We're starting chemo, or, one will be down and then just 6 more months to go and everything. But I knew that it's going to get a lot worse before it gets better. and that this is a lifelong, cancering is a lifelong journey. I still struggle with late effects from my cancer and my chemotherapy treatment from when I was 16. I'm 33, and it doesn't end. The biggest mistake people make, in my opinion, is thinking that cancer is a one and done. You're done, because cancer is a lifelong journey.
And I think that mistake is most commonly made by people in support roles to say, but you're done. You're done.
Right.
Casey, thanks so much for coming in and sharing your really unique perspective. You've had all these different roles, from patient to researcher and now in a support role. I know a lot of people listening feel like this embodies what we mean by cancering. Cancer is a verb. It is an ongoing process, and in our lifetime, it'll touch us in a lot of different ways.
I completely agree. And I like to share my perspective and my stories, both mine and the ones that I'm living with others. And I think it's really important to remember that even though there's no denying that there's struggles, that we live day in and day out sometimes, and it's just a matter of, can we get to the next morning and getting dressed, and maybe I don't want to shower for 4 days because I'm exhausted and there's so much going on. But no matter how worn down and beaten down and bleak things seem sometimes, I'm never going to give up on this. I know you're not ever going to give up on this. Cancering is a verb. It's a journey. For some of us, it has become a passion. It's become our lives. And it's something that I will spend the rest of my life focused on, impassioned about, and I'm never going to give up that fight until we get it.
Yeah. And, I think that also that there's so much hope that survivorship, the stats, although meaning very little, the stats for Wilms tumor are incredible now. When 30 years ago, these tumors were almost untreatable, not just uncurable. And there's so much hope in the research that we see, in the patient experiences getting better from better treatments, more targeted treatments, more specific treatments instead of whole body type treatments. And that, not unlike your experience, that someone can take a cancer journey and turn it into a lifetime of giving back.
And the outpouring of love and generosity that we've seen from friends and family and strangers. I told wonderful friend Carol McPhail that she asked me one time, what got you through when you were going through cancer? And I told her, the mail. I used to look forward to getting mail every day because I got something, a card or a package or something, and it just made me feel so loved. And it restores your faith in humanity almost, to know that there are people out there who care and who love and support, and we are all in this fight together.
Because cancer affects everybody.
It does. It touches every person until you and I make sure that it doesn't. We are all in this together.
This is a great way to end. Thanks again for coming.
Thank you so much for having me.
Thanks, everyone, for listening to The Cancering Show with J.Y.P, Dr. Jennifer Young-Pierce. Please subscribe, rate, and review this show on iTunes and anywhere else you listen to your favorite podcasts. Want us to deliver The Cancering Show to your email inbox? Contact us at cancering.com, and we can make sure you never miss an episode. We would love to know what you think about the show, or if you have any suggestions on topics you would like to hear. You can reach out to us on Facebook, Twitter, and cancering.com. Until next time, be healthy, happy, and always thriving.
This show is brought to you by the University of South Alabama Mitchell Cancer Institute. MCI is a cutting-edge cancer research and patient center built to fight cancer smarter in Mobile and Baldwin County, Alabama. Our researchers and clinicians focus daily on the struggle against cancer, serving a potential catchment population of more than 4.1 million people, with a singular focus of advancing cancer diagnosis, treatment, and prevention throughout the Gulf Coast and beyond, with science, technology, and hope. Want to know more about the Mitchell Cancer Institute? Visit us at usamci.com or search for us on Facebook, Twitter, and Instagram. Mitchell Cancer Institute is a member of U.S.A. Health. To learn more about all of our hospitals, clinics, and services, visit usahealthsystem.com.